Good morning, everyone, and thank you for joining us for this educational program. Again, all lines have been muted to ensure the audio quality and provide a distraction-free learning environment. At the end of this presentation, we will allow for a live short Q&A. You can use the comment section to send questions, and we will address as many questions as time allows. At the end of this program, we will send you an evaluation. We ask that you please provide us feedback to ensure that we best serve the lupus community and provide engaging future programming. This is the third session of Navigating the Pediatric Lupus Journey. Each session attended, the pediatric patient will earn a reward. A $5 e-Target gift card will be awarded for each session. At the completion of the webinar series, any reward earned will be distributed to the pediatric patient. After the completion of all 4 sessions, the pediatric patient will receive an electronic gift card and a certificate of completion. I'd like to take a moment to just give a brief disclaimer. The Lupus Foundation of America Greater Ohio Chapter does not give medical advice to patients regarding their lupus treatment. Your physician is the best source of information regarding your medical management of your lupus. This program is available for informational and educational purposes only. The content provided by other providers and/or professionals within the context of this program is not necessarily the opinion of the Lupus Foundation of America. We can now begin navigating the pediatric lupus journey. Thank you again for joining. My name is Leslie Viscara-Tierney. I've been dedicated to the mission of the Lupus Foundation of America Greater Ohio Chapter for over a decade. And I thank you for joining us this morning and taking a time to learn more with us. We are looking for ways to reconnect in person in the near future. Projects are being carefully considered, and we are hopeful that we can gather together real soon. But for the meantime, we look to the bright side of digital programming. You can now learn from lupus experts and professionals across our state and in the comfort of your own home. Today, our expert has created a presentation specifically designed to help you better understand lupus and provide best practices for managing chronic illness. We have an excellent program created for you again today, but first I would like to take a moment to recognize our generous sponsor. Funding for this program has been made possible by GSK, Us and Lupus, and truly we would not be able to host important programs like this without their sponsorship. So thank you GSK and Us and Lupus for your support. And that brings us to our presenter this morning. Joining us this morning is Dr. Elizabeth Brooks. She's a top pediatric rheumatologist at the Cleveland Clinic. Dr. Brooks completed her rheumatology fellowship at Brigham and Women's Hospital in Boston, and she's a board certified in internal medicine and rheumatology. She has worked on numerous publications and has been honored with many awards for her outstanding achievements. When the chapter first reached out to Dr. Brooks to collaborate on this project, she quickly showed her passion and commitment to helping improve education, awareness, and support of lupus patients and the community. Dr. Brooks is presenting today on systemic lupus erythematosus, lupus in and outside of appointments. So welcome, Dr. Brooks. You may have the virtual floor, and just give me one moment as I give you presenter. And you should be able to take control now, Dr. Brooks.
Good morning, everybody. Thank you for joining us this Saturday morning. So I was asked to talk about working with your doctor, and I've set up this talk to talk about things that one thinks about before the visit, during the visit, and after the visit. And I hope this will be helpful for everyone. So the first thing I'm going to bring up is the importance of feeling comfortable with your team of doctors. If you're not comfortable with your doctors, then it's very hard to have trust. It's very hard to feel comfortable asking questions. And it's very hard to feel like you're moving forward and dealing with your lupus. You should not be afraid to ask any questions. We're here to help you understand your disease and help you come up with strategies that work for you in terms of disease management. My motto has always been, there are no stupid questions. If somebody doesn't know things about their disease or worries about things, that's not going to help you get better. We all feel very strongly that doctors should never judge their patients. We are here to help you and not be judgmental. If you're not comfortable with who you're working with, consider switching when that's an option. You need to have a physician that you can trust and that you feel like you can communicate with about anything. The other thing that's really important is taking an active role in your medical care. Especially for older teenagers, we want to help you with the transition process where eventually you'll move to an adult practitioner. And the only way that you can learn what you need to do and start moving forward in that process is by taking an active role in what's going on. For younger patients, we expect the parents to be involved in the care. And honestly, patients don't do well when it's just us telling people what to do. Think about what you want to accomplish or get out of each office visit prior to coming to the visit. Do you need medication refills? Do you have paperwork that needs to be filled out? Do you need a 504 plan for school? Get any questions answered, and sometimes it's helpful to write them down. I know for myself, when I walk into the office, my mind goes blank, and I just simply answer the question the doctor asked, and I forget about what I really wanted to accomplish during that visit. Make a list of any questions, and that may include questions about lupus, questions about symptoms that are happening, questions about medication, questions about how any upcoming tests might be done, and any other questions that you feel are important to you to understand what's going on. Anything that you're feeling uncertain about, scared about, worried about, definitely plan to bring up at the visit. We can help and allay any fears, allay any worries, and verify, yes, this is something you need to be concerned about, and here's what we'll do to fix it, or figure out what's going on, as well as give reassurance that, no, things are going great. You really don't have to be worried. Make a list of what you want the doctor to do. As I mentioned before, things like medication refills, letters, forms, anything else that you need to come from your physician. It's very helpful to bring a list of all the medications and vitamin supplements or the bottles themselves to all office visits. Bottles are much more helpful because then we can actually see how many refills are left and whether you need a refill sooner than what the computer might suggest to us. It's also helpful to verify any medicines that were given by other providers that may be in a different system than the system that the rheumatologist is in, or if somebody changed any doses of medications. Also bring a list of all allergies. During the appointment, it's important to listen all the time. For teenagers, it's preferable to not have you sitting in the corner playing on your phone. We really want you to be an active participant in the conversation and the appointment itself. There's a lot to learn from coming to these appointments, and we don't expect that you're going to be sitting there and not participating in the visit. Ask questions if you don't understand. If somebody asks you a question and you're not too sure what they're talking about, feel free to say, I don't understand what you're asking, or I don't know because I don't really understand what you're talking about. And feel free to repeat back to us what either the physician or the nurse said to make sure that you understand what we've told you. we will often actually repeat ourselves by asking back to you in the course of the history to confirm that we heard what you said to us correctly. Make sure you have full understanding of what needs to be done after the visit. Is there a need for labs? And if so, how soon do they need to be done? Are they to be done that day? Can they wait for a couple of days? Or are they to be done in the future? Any x-rays or MRIs or CAT scans that need to be done? Other tests such as echocardiogram, pulmonary function tests, other things that somebody might order. And then, do you need appointments with other providers or specialists? And those specialists may include a dermatologist if there's skin issues, nephrology if there's kidney issues, pulmonary if there's lung issues, cardiology if there are heart issues, hematology if there's any issues with blood counts or somebody's anemic or the red blood cell count is low, ophthalmology to manage the eyes, neurology if there's brain issues, headaches, or other things happening. And you may work with a social worker. Many of the social workers can be helpful with regards to helping with transition, with helping with insurance issues, with helping with school issues, and helping with other things that may be coming up. And then sometimes it's helpful to talk to a psychiatrist or a psychologist. If you're feeling really frustrated by your lupus, if you're feeling down, if you're having a hard time at school because you feel like people are teasing you, all of these things are important to talk about. If you're on hydroxychloroquine, Plaquenil, it's important to get a yearly eye exam. Sometimes the eye doctors may want to see you every 6 months rather than once a year, depending upon your individual situation. Do you need to schedule infusion appointments if you're on an IV medicine? Things like rituximab, belimumab, maybe some intravenous steroids. Some patients end up on Cytoxan. There are various different medications that we use. Do you need to follow up with your primary care physician? It's very important to continue well visits, not just see the rheumatologist. There are various things that need to happen as kids grow up, and so it's important to keep up that care with the primary care physician. And then, do you need to follow up with a dentist? Dental care twice a year is also critical, especially if you're on a lot of medicines, and making sure that there's nothing going on with the teeth. As much as possible, try to schedule a follow-up visit before you leave the office. It's very easy to forget to do it after you've left. You can always ask the physician, hey, can you help me get scheduled now? And just do it during the course of the visit. Ask for any medication refills that you might need before you leave the office. And ask for any school or work excuse letters that might be needed before leaving the office. That way you've got everything you need and you don't need to make an additional phone call to try to get those things done later. It's important to know when you need to contact the doctor and how to get in touch with the doctor. Most physicians will give patients a business card at the first visit. If you lose it or if you can't find it, feel free to ask for another one. My practice is to give a business card to the patient when they turn 18 so they know to contact me as well. If you're having fevers, it's important to let somebody know. If you're not feeling well, if you think you might be having a reaction to a medication, that's also something that's really important to bring up. If you run out of medicines that you didn't ask for at the visit, it's really important to give us several days notice and not expect to get a medication refill that same day. If it's an emergency situation, certainly we will all fill the medication, But there are some offices that refuse to sort of jump and do it same day, except if there's extenuating circumstances. Try not to request a medication refill on a weekend unless it's a real emergency, because the physician who's on call may or may not be willing to do so. So really plan ahead, monitor how many refills you have and when the bottle's going to run out. Let us know regarding any lifestyle changes. Also, let us know if you're having issues obtaining your medicine. The pharmacies don't always let the office know if you need a refill. And so that's where if you request a refill yourself, then there won't be any lag in the medications. And also let us know if you're having trouble getting appointments, either a follow-up with a rheumatologist or follow-up with any specialist. If you're asked to see a specialist and you get given an appointment 6 months from now, that's not going to be very helpful. Reach out to your rheumatologist and let them know, hey, I can't get in, because maybe they can make a phone call and help facilitate getting in sooner. It's important to follow any necessary dietary restrictions that are given to you. Patients who are on high doses of steroids may ask to maintain a low sodium diet so they don't absorb and hang on to a lot of fluid. Patients with renal disease may ask to be on a kidney diet, and especially if they have severe renal disease. Make sure to continue all medications even if you're feeling well, because it's very likely that the reason you're feeling well is that the medicines are controlling the lupus and helping you to feel better. Definitely make sure to discuss with your physician before stopping any medications without being told to do so by the physician's office. It's very hard for us to help get the disease under control if medications are not being taken as prescribed. Also discuss any vitamins or herbal medications with your physician that you think you might want to start, because some of these will interact with the medications you're taking. Herbal remedies and vitamins that are said to improve your immune system may actually interact with your immunosuppressant, which is trying to suppress the immune system to keep the lupus from attacking the body. And so it's very important to ask about any of those kind of things before starting anything. The other thing that's very important, because sometimes the front desk don't do this, is check and make sure that your contact information is correct at every visit. If you've had a phone change, an address change, an insurance change, it's really critical that we know about those things. Make sure that we have your correct and preferred pharmacy listed. Also make sure that we have your current insurance. Any changes in the insurance need to be reported right away, because some of the medications you may be on may need a prior authorization. And when the insurance changes, we have to go through that prior authorization procedure again. And we don't want anybody to be lacking in their medication because they've shipped their insurance and suddenly they can't get it. Make sure that you understand how to get care after office hours and on the weekend. Who do you call if you need help? Is there a central number to call to reach the on-call person? Do you call the office number? What do you need to do in case you need help on a weekend or after 5? For people that have access to things like MyChart and Follow My Health, it's very, very helpful to have you sign up for those. You can communicate with us to request refills. If it's a non-urgent question, you can send that through the electronic medical record. But we ask that if it's an urgent problem, it's really important that you call the office, because those requests that you send via MyChart or Follow My Health do not go directly to the physician. They go to a central pool, and then they get sent out to whomever they need to get sent out to. So we may not see that message the same day you send it. If you send it after 5 or on a weekend, it's not going to be seen until the next business day. And so it's really critical to think about when you need help and why and how urgent is it. For teenagers, as you get older, you'll be asked to take more responsibility for your care, and we will be helping you learning how to do this process. I am involved in the transition program at Cleveland Clinic. Dr. Stacy Ardoin, who's going to be talking next in 2 weeks, is involved in transition at Nationwide Children's. And there's a group of us around the country that are really vested in giving teenagers the training they need so that once they get to be 18 and older, they know how to function in an internal medicine world. It's very different than pediatrics, and you really need to learn how to take responsibility for yourself. And as much as possible, it's helpful to start that process while you're still in pediatrics so we can help you learn the skills and tools that you need. One of the things that a lot of children don't know what to do is how to make a phone call to a doctor's office if they need to. So this is an example of how a conversation might go. You call the doctor, somebody answers, and they'll say, "This is Dr. So-and-so's office, how may I help you?" And if you're calling to make an appointment, you'll say, "I'd like to make an appointment to see Dr. So-and-so." And then they'll find out whether you've ever seen that provider before or been to that office before. And so you'll let them know that you have. They'll ask you for your name and date of birth so they can confirm that they have the correct patient. And so it'll be important that you give them that information. And then depending upon whether you're calling a scheduling department or the office themselves, they may ask you what kind of problem you're having. And if you're actually having a problem, you're going to tell them the problem. If it's that you need to schedule an appointment, you'll tell them that you need to schedule an appointment. And then they'll go ahead and ask you what day you want to come. One of the things that's really critical when you schedule appointments is think about what the work schedule is, what the school schedule is, how long does it take you to get to an appointment? Are you driving during rush hour? Are you driving during a busy traffic time? Or is it only going to take you a few minutes to get there? And that way you can cut down on the number of times that you need to reschedule your appointment. So I'm going to stop there and allow for questions.
Hi, Dr. Brooks. Great. Let me just grab your screen real quick. Give me 1 second here. And you can use the comments section to send in any questions if you guys have any questions at this time. Let me just show my screen. There we go. Okay, well, thank you, Dr. Brooks. You know, within our chapter, a few of our patients have let us know how very thorough you are, and I can see that in your presentation. I really liked how you set some time aside to talk about like making the phone call in that scenario. I think that's a good example of, you know, giving kids leadership skills and letting them know like how to navigate that process. So I have to agree with some of your patients that say you're a thorough physician. And okay, you guys, if you could use the comment section to submit any questions, I'd be appreciative. And let's see, it's so tiny on my screen, but let me open up the questions section. And a few are rolling in, very good. What do I do if I don't agree with the treatment the doctor has suggested for my child?
My suggestion would be talk to the doctor about it. Tell them what you're concerned about, why you're concerned about it. And if they are unwilling to have a discussion, then it might be time to think about whether you want to get a second opinion from another provider, either in the same institution or in a different institution. There may be specific reasons why the provider picked whatever treatment the patient is on, but it's important to let the provider know that you have concerns about what's happening.
So having that open, honest, just conversation and just talking about it. Great.
Definitely. And don't be afraid to say, hey, I'm not really happy with what we're doing, because that's important for the doctor to know as well. You can't have a good doctor-patient relationship if you can't discuss those kind of things. And the doctor may have a, extremely valid reason for using the treatment that's being used, and it may be they just didn't do a good job of explaining why. And so if you can have a discussion, then it's helpful.
Okay. One's coming in that says, I really don't like needles. Is it really necessary to have my blood drawn every few months?
Yes, it's important. Most lupus patients end up on medications where we have to monitor for any medication toxicity. It's also the only way that we can really make sure that your lupus is doing well, and make any necessary changes in medications if it's not doing well. We can't see how lupus is doing just by asking you how you're feeling. There are things that go on inside the body that you may not have any symptoms from, but if we can pick up that there are changes happening before you start having symptoms from it, then we can actually hopefully keep it from becoming really severe. There are some techniques that you can use to try to help make the needle stick easier. There's a website which is called Pain Care Labs. And if you go to that website, they have a handout that talks about tricks for how to tolerate needle sticks. And I'm going to actually bring it up on my computer, and then I'll have Leslie switch over to my computer in just a minute.
Yeah, let me know when you pull that up, Dr. Brooks.
Yeah.
Well, I was not aware of Pain Care Labs website. That's a great suggestion. I don't think anyone really likes to be poked with a needle too often, but it is a necessary thing to monitor just activity of things.
So if you want to turn it over to my screen, Leslie.
There we go.
Okay. So Pain Care Labs is the website for Buzzy for Shot, which some of you may be familiar with. And what it is, it's a device that you put on if you're getting an injection, and the body, the brain, senses the cold and the vibration from the device and doesn't actually feel the shot quite as intensely. So let me find, this is an example of what happens is the pain fibers are sensing this rather than this.
That is so neat.
One of the things that, whoops.
That's okay. Buzzy, I was not aware of this.
Yeah, it's extremely helpful, and VibraCool is another version of it. So let me go in
Like
this.
distraction for your brain. It kind of feels a vibration and doesn't really recognize such a painful step.
Exactly.
I saw a little magic trick a couple weeks ago with someone kind of manipulating sensations like that. That's really cool that they figured that. Neat. Buzzy. That's wonderful.
Now, I don't know why I can't get this. There we go. Now it's opening. So one of the other things that the woman who designed this, and the person who designed this is actually an emergency room physician, is they have a bunch of distraction cards. And the distraction cards have games on them that are age appropriate. And so for the younger kids, if you have them focusing on the card and do whatever the game is that's written on the other side while the either blood draw or the shot is occurring, that can be extremely helpful because that way they're focusing on something other than the poke. Now I'm trying to find. So this is a needle fear education kit, but if you go to the website, it says you can download their PDF.
Perfect.
And so these are actually the cards, and you can download these and print them. And it gives lots and lots and lots of good suggestions in terms of how to deal with needle fear. And it gives suggestions for how to deal with getting shots, whether it be a poke for blood draw, whether it be a poke because somebody needs a shot. And these can be extremely helpful. When I remember to, will give these to families in the office. But if you just go to the Pain Care Lab website, click on Shop for Buzzy, and then look for the Needle Fear Education Kit, you'll find these cards. And they've got very, very helpful tricks in them.
I like that a lot. I like the download portion there too. I might have to grab that and pass that along. So that's a wonderful free tool to just help our families get past that sick. And I know some adults that have, fear of needles too. So maybe this is
exactly. I mean, there's many adults who are scared of needles because of things that happened as kids.
Yeah. And unfortunately, no one likes to be poked. So.
Right. The other thing is depending upon where you get the blood drawn, there may be a Child Life person there. And ask the lab to call Child Life. And Child Life, honestly, is available for any age person in the pediatric world. Mm-hmm. So even if you're 18 or 19, if you're deathly scared of needles and having to go get your blood drawn is an absolutely horrendous thing to have to do, ask the lab to call Child Life. At Cleveland Clinic, Child Life is only available at the main campus in the R building. We have actually a lot of our families who opt to drive to the R building to get their labs drawn when they have to get it drawn outside of the appointment. And they find that it's extremely beneficial because of the presence of Child Life.
That's neat. That's a great suggestion. Another thing I didn't know, but that's really cool. All right, I do have a couple more questions coming through here. Someone's talking about the refill of their medications. You had mentioned like you can do that at the time of like when your appointment's ending, but is there an issue if the prescription isn't due for a couple of months is what they're saying? Should I still ask if it's still a couple of months till the prescription needs to be refilled?
If the prescription is due to if you still have a couple of months worth of refills, then it's better to wait and use your refills because whenever we write a new prescription, it wipes out the prescription that's at the pharmacy. and so you start all over again. So I would recommend, if you've got a couple months worth of medication that you still have access to, go ahead and use your refills, and then, at least 2 to 3 days before you need your refill, reach out to the doctor's office. Sometimes, if it's a medication that is a medication that might need a prior authorization, either a medication you inject at home or something like mycophenolate mofetil, it's better to actually reach out further ahead than that. I would say 5 to 7 days in case it turns out that a new prior authorization is needed. So the refill goes through smoothly, and it gives us time to do the prior authorization before the medication runs out.
Okay. That makes sense to me. And that was a good question too, when's the best time? Another question here is, my family recently switched insurance and the new provider won't cover the medication that was helping us before. They said our lab works looks healthy. They don't understand that I'm healthy because I've been on the medications. What do you recommend?
Is the issue that the insurance will not cover the medication?
I believe so, or they have a new provider. I'm assuming insurance, new insurance.
Okay. If the issue is the insurance won't cover it, the provider can certainly do a prior authorization and try to fight with the insurance. Unfortunately, some insurances are very picky. The other thing that you can do is try getting drugs through the pharmaceutical company. Some pharmaceutical companies have programs where if the medication is not covered by your insurance, they will give you medication for a certain set period of time. Other times, depending upon what the medicine is, if you try using things like GoodRx, sometimes you can find a price that's affordable for the medication so that you can continue it that way and just pay out of pocket. Sometimes, unfortunately, it's necessary to switch to a different medication, and that's something that definitely upsets all of us when somebody's doing well on a drug. But unfortunately, it's often out of our control. If there are no other options beyond that medication, then I think there are sometimes legal options in terms of trying to get it. But often it's possible to have the physician have a conversation with the insurance, explain that the patient's been on this drug for a long time. Because if somebody comes to a new insurance on a medication, many insurances will continue the medication.
Oh. All right. It is always difficult when navigating new insurance companies and kind of going through that process.
Exactly.
Things will work out, making those calls and spending the time to figure out what the best solution is, but talking with your doc too to see what you can do. Okay, one's coming through. What about mental health for parents and child? Should we do it together? I'm assuming like mental health counseling, maybe? Should the parent and child go through counseling together?
It depends on the situation. Depending upon the age of the child, the mental health provider will meet with the parent and the child. Depending upon the issue, they may also meet with the child alone in terms of being able to get a better sense as to what's going on with the child. Family counseling is also an option, and depending upon the issue, Often mental health providers who are seeing the patient will recommend that actually the whole family have counseling together in an effort to also help the patient. So it depends on the issue that's ongoing. If it's an issue with, I don't like being different, I don't like having this disease, I don't want to take my medicines, I don't want to do any of this, sometimes engaging the whole family can be helpful. But the mental health provider will probably meet with the child alone in addition to the parent.
I think it's good to talk separate and together. I mean, I think both are a good suggestion, right? You get the child to voice their feelings without mom and dad around, and then you get to do that alone as a parent as well. So, and then even together, just receiving it together. So I think a licensed professional will help the family get through that. And actually, our chapter is working with Signature Health right now, and we're trying to build a partnership where we can kind of pass our support groups. Our support groups are self-help groups, but we can offer an additional service for, you know, a professional to come in and assess the needs of the patient. So we're doing that, and then, you know, talk to your healthcare provider, of course.
Yeah.
Okay, so there is.
I'm going to interrupt for just a quick second. It's important, if there is concerns about mental health issues, to bring this up with the rheumatologist and really work on getting in with a mental health provider. Unfortunately, there's a big crunch in terms of shortage of mental health providers right now related to the pandemic. But, you know, most rheumatologists will work really hard with you in terms of trying to get kids in quickly when it appears that there's an issue that really needs to be dealt with now.
So if there's an issue, don't wait. Talk to your physician right away, especially your rheumatologist, about seeking help to talk with someone.
Exactly.
I hear that.
Some social workers are licensed to act as psychologists. And so if you're working with a social worker, that individual may be able to be really helpful as well. Mm-hmm. And so definitely talk to them as well. They also will have connections different from the physician connections and may be able to get somebody in sooner. And I will often reach out to our social worker if I have a patient that I'm really worried about in terms of trying to get help with that situation.
Great. So probably if you're voicing that there, they could send in someone rather quickly to talk with you and address some things right away at your initial appointment. When
exactly. Yeah.
I know you
don't wait until something bad happens.
That's right. That's right. If there's something going on, talk about it. Get your physician involved. So the same person is saying there's so much information out there on the web and my teen has access to it. It's all so confusing. How do I message her so that there's so much info that we must just stay focused on? I'm so sorry. How do I guess it's like, how do we focus on like the correct information, perhaps? You know, the right information.
Okay.
A lot out there on Dr. Brooks, I think, is the.
My suggestion is go to websites that have a .org, such as lupusfoundation.org, arthritisfoundation.org, or medical websites that are associated with hospitals. So the Cleveland Clinic website, the Mayo Clinic website, many children's hospitals will have their own websites. And a lot of these websites will have patient information. Mm-hmm. The American College of Rheumatology, which is rheumatology.org, has a lot of patient handouts on it with information both about diseases as well as medications. I will often use these handouts to give to parents and patients when I see them in the office. Try to avoid the .com sites because you don't have any way of assessing how much of that information is coming from medical providers versus somebody just posting information.
You know, I tend to know a lot of people are in chat rooms and speaking with one another, and that's great to connect with people in chat rooms and things of that nature, but that shouldn't be the main source of information. You get a lot of people's opinions and things of that nature, you know, medically reviewed sites, like you're saying, like .org sites, like the Lupus Foundation, lupus.org, lupusgreaterohio.org. These are good sites that have been reviewed to share factual information. So, you know, if the kids are hanging out in chat rooms, maybe monitor those types of conversations if you can, and help your child with the information or content that's going on there. Because I know that's pretty popular, chat rooms and situations like that. So if you're accessing your information through a chat room, maybe, you know, steer them towards government-related websites, hospital websites. So, okay, let's see if I can get any more here. Oh.
Don't hesitate to ask the physician about things that you're reading online. Write down what you're finding and bring it to the appointment and have a conversation about it. And then we can say, yes, in fact, this is correct, or no, I don't think this is correct, or I've never heard of this before, let me do some research.
That goes back to our last week conversation with journaling and stuff. That's a great place to have that notebook to write those questions down. Great, yeah. So this one is, one of the nurses told me it's dangerous to have garlic and with having lupus. I really like garlic. Is that true?
I have not heard that comment before. So let me actually do some homework on that one. And I'll reach out to Leslie and then she can get back to you. But that's not a comment I've heard. It's possible that the nurse was concerned about interactions with medications, and that was what the issue was. There's no question that herbs and certain vitamins can interact with prescription medications. And so that may have been the issue, but that's not a comment that I've heard before.
I could see maybe if you're having garlic, it's upsetting your stomach or something's happening after you're eating it. But if nothing's happening and you're enjoying mom's spaghetti sauce, well, we'll look into that, Dr. Brooks. Thanks for that. I chuckle because I love garlic too. So. Okay, yeah. I'm just looking through. I think. Oh, I see one coming through. So, should I tell my doctor when I'm sick with a cold or a flu? Does it matter with a cold or a flu?
Yes, it's very important that you do so, especially if it's the flu. And in the era of COVID, it's important to reach out to your doctor if you've got sore throat, cough, not feeling well, so we can help you sort out whether this might be COVID rather than just simply a cold. If one is on an immunosuppressant, depending upon the severity of the infection, you may need to be seen, the medication may need to be adjusted. There's a lot of different things that need to happen. So it's really critical that you let your physician know if you're sick, regardless of how little sick you think you are, because sometimes people can be sicker than they think. And both steroids and the other immunosuppressants can actually sometimes mask the severity of the illness until somebody's critically ill.
Right. Well, okay, yeah. I mean, building that good patient-physician relationship is something we encourage, and Dr. Brooks, you definitely hit upon that. And you know, having a good relationship and being able to talk. It's okay to ask them or let them know that you have a cold, especially right now. You know, just a sore throat could be the first sign of testing positive for COVID or whatnot. So very good. Let your doctors know. Okay, I mean, we're gearing down here just a little bit. I don't know if there's any other questions, but I really enjoy the questions that come through. The garlic one's going to sit with me all day. I'm going to be curious about that. And I think if there's any other questions, I'd be happy to get them. And if you come up with a question after this presentation of maybe something you wanted to, if you message that to me, maybe I could get it over to Dr. Brooks, and maybe she'd be able to answer it at a later time too, if
Sure.
they didn't have time for it. So I am just, sorry about that. Another reminder, just another thank you to our generous sponsor. Funding for this program was made possible by GSK and us and Lupus. We would not be able to host these important programs like this and sit and have candid conversations with our experts without help from sponsors to provide programming. So thank you so much to GSK and us and Lupus for their continued support. Please be sure to join us for the last and final session. It's number 4, Navigating the Pediatric Lupus Journey. That'll be Saturday, September 10th. Dr. Brooks had already mentioned that we have Dr. Stacy Ardoin, and she's going to be talking about growing up with lupus. And we will also have a pharmacist, Kelly Wise, who has an interesting program called No Blame, No Shame, How to Win the Medicine Game. I'm very curious to see what she has to say. Sometimes medications can be difficult to manage, but I think she has some ways to help us be more compliant with our medications. And if you haven't done so already, you can hover over that QR code to get to our website to register for the final session there. If you've already registered for all 4 sessions, you'll be automatically pushed through. But I do thank you guys for joining us, and I thank you very much, Dr. Brooks, for being our expert panel today. And just again, thank you for attending. This brings us to the close of our 3rd session of Navigating the Pediatric Lupus Journey. Thank you everyone for joining. We are tremendously grateful for our expert panel that joined today to help create a path to empowerment. Please remember to complete the evaluation. One will be sent to your email box 1 hour after the program, and actually right after you exit, a pop-up will appear if you want to take it right after this program. But please remember, each session registered, attended, and an evaluation submitted, the pediatric patient will earn a reward. A $5 eTarget gift card will be awarded for each session at the completion of this whole webinar series. And the rewards earned will be distributed to the pediatric patient. After the completion of all 4 sessions, our pediatric patient will receive an electronic gift card and a certificate of completion. So that's great. Also, please be sure to periodically check out our website, lupusgreaterohio.org. Sign up for our emails, keep up to date on information, services, programming, fundraising opportunities. You can also call 1-888-NO-LUPUS for more information or to get connected with the local patient navigator. We are committed to providing you with the most accurate information as it becomes available. So for right now, be safe and continue to strive to find optimal health. We hope to see you guys soon, and thank you again, Dr. Brooks, for joining. It was a wonderful morning with you.
Have a great weekend, everybody. Don't forget to use your sunscreen.
Very good. Yep.
Thank you for coming.
Thank you, everyone. Have a great weekend. Thanks, Dr. Brooks.
You're very welcome.